works, right? What usually happens with infections is that during that infectious process, some persons develop a very, very severe immune reaction. And that immune reaction is what can cause death sometimes. So if immune system can be alerted before, it can avert this excessive reaction, which can lead to destruction of organs and systems and maybe even the person's life. What usually happens with infections is that during different ways to avoid COVID-19 or limit the possibility of infection. We all know about the New Start. There's personal hygiene processes, barriers such as masks and gloves, environmental factors, ventilation, physical distancing. Of course, certain supplements may boost immune system, and of course, vaccination. And just as with us Christian life, we don't want to confine ourselves to just one. The Bible speaks about putting on the whole armor, and this applies to the to infection control as well. Now, what's a vaccine? Now, if you go back to the immune system, diagram that I showed you just now, immune system. When God created man, He created him in His image. He gave him intelligence. And He told man to have dominion over the earth. And He put him in a garden to dress the garden. The garden was already perfect. So what was man going to do with this garden? God gave man the intelligence to know what to do with the garden, even though it was perfect. Now, the immune system is like a garden, right? And we are designed to have that intellectual capacity to modify that garden that God created. He gave us that intelligence. So vaccination is like a dressing for your immune system. It's like Adam dressing the garden. It's the same thing with the vaccines. The vaccine was meant to dress the garden of our immune system so that it can look even better and function better. Vaccine is made up of a part or a whole of a germ, which can cause a safe immune reaction. Sometimes the germ itself, if it gets to the immune system before, the immune reaction may be severe enough to cause harm. So we want to avoid that. And vaccines also protect against complications of these infections. And it's best given before the infection actually occurs. Now, vaccines have been on for a very long time. Some persons think as far back as 200 AD, so they're not new at all. And this is a short history of vaccine development. Of course, it's not the entire thing, but just a synopsis of it. So vaccines, they alert the body about cells so that they can be prepared for it, and because of the production of the memory cells, right? The memory cells, and these memory cells are able to identify and destroy the cells if they should come again. Sometimes before they come inside the body, sometimes if they have come in, they can actually destroy the germ. They reduce the likelihood of transmission, and they help to develop herd immunity. And herd immunity is when enough persons are immune to a germ to prevent the infection from spreading. Different germs at different levels necessary. For example, with measles, 95% of persons have to be immune to measles in order to stop spread in a population. So different viruses have different ability to spread, so the level is different. And they have helped to eradicate disease, and they may also help to prevent injury and death. And let me just say, first of all, the COVID-19 vaccine does all of these things. It does all of them, and therefore it does qualify as a vaccine. Why is vaccine important? Because they help to prevent injury and death. And just give some examples. Measles, which is something that we are quite familiar with in terms of vaccination. 25% of persons with measles need hospitalization, and 1 to 2 persons per 1,000 die. And we are quite accepting of measles vaccination. It only kills 1 to 2 persons per 1,000. The fatality rate of influenza is 0.02%, and there is vaccination for that. Now, COVID-19, 14% develop serious disease, 6% develop severe disease that have to be treated in the hospital, and 1 to 3% die. And that is, of course, worse than measles and influenza, which already have vaccines available for them. So of course, it would be a logical thing to, if it's amenable to a vaccination, then vaccination will be definitely a reasonable option. Now, another thing that's important is that 30 to 40% of persons are asymptomatic, and up to 60. It has been estimated that almost 60% of the spread of COVID-19 or the virus is persons without symptoms. So you may have it and don't even know, and you pass it on to somebody else, right? It also causes social isolation, both with infected and uninfected persons, right? Loss of income, again, both infected and uninfected persons, lots of business. And of course, it severely impacts the health system. It's happening right now, as you heard what the doctor said. Persons with other conditions are being squeezed out because there's no space for them. And some persons with other conditions, I recently, this patient was telling me how her husband, we went into hospital for another reason, got COVID and died in the hospital because of COVID-19. And that's not what he went in for. Right? So these are things that are happening to persons. Right? Now, there are some persons who are hesitant to take the vaccination, and this actually gives us a picture of those persons who are hesitant. And as you can see, unfortunately, the persons who are more hesitant than the average include us as Blacks. We are more hesitant, and unfortunately, healthcare workers. So healthcare workers are more hesitant than the average to accept the vaccination. And why are some persons hesitant? They don't think the vaccine is safe, and they are concerned about the side effects, and they don't think it's dangerous, and etc. So there are various reasons why persons are hesitant. Now, these are some of the effects that COVID-19 can have on your body. These are medical language, so I'm going to explain some of them. The acute COVID-19, in other words, when you have just gotten it, during the infectious process, you may get strokes. You can have damage to your blood vessels, damage to your brain, loss of smell and taste. It may cause a pneumonia, may cause abnormal heart rhythms, damage to your heart. Right? It can affect the blood clotting. It can either cause it to bleed excessively, or it may have excess clotting, and this actually has killed some persons. Not the infection itself, but the clotting problems that may occur can damage the kidney. That kills some persons as well. Damage the liver, damage the muscles, and what we call long COVID. It can cause impact on your brain function. You don't think as sharp. You may have mood changes, anxiety and depression, chronic fatigue, long-term shortness of breath, chest pains, and continued clotting issues, continued kidney problems, wasting of the muscles, weakness, and so on. So it may cause short or long-term problems, right? And this is something I want persons to remember, the impact that COVID can have on your body, both in the short and long run. These are some of the examples of some of the types of vaccination. There is the RNA vaccine, mRNA vaccination, which Moderna and Pfizer, and also there is the ones made from the adenovirus that includes mainly the AstraZeneca and the Johnson & Johnson. Then there are those with the actual. Now, what these vaccines, what they do is that they present the body with some material that they can recognize and react to that may trigger the production of the memory cells that we spoke about earlier, right? So the subunit vaccines, it's actual proteins. In case of the adenovirus vaccines, what they have done is that they have used adenoviruses that are not usually infectious. They neutralize them so that they can multiply inside the body, but they will have the genetic material for the outer protein of the virus, and so that is produced by the body, and then it's presented to the immune system so it can recognize it. So if it comes across any germ with that marker on it, with that protein on it, it will destroy it. The mRNA vaccines, they also have the instruction for the same protein, and it goes into the cytoplasm. It does not go into the DNA, right? It doesn't go inside the nucleus. It doesn't affect the nucleus in any way. This is one of the misconceptions that persons have, that it goes into your nucleus. It does not affect your DNA in any way. It just goes into the cytoplasm, which is the outer part of the cell, and the protein is made there and then presented to the immune system so it can be aware. And you also have Sinopharm and Sinovac, which are weakened forms of the virus, something similar to the measles vaccination, using that same technology, so that the immune system can react to it, right? And this is basically what we just said. The mRNA vaccine triggers the production of the cells of the proteins, spike proteins, and this triggers the immune system. All right, so it doesn't affect your DNA in any way or form. All right, what's in the vaccine is an example. You have water. There is the active ingredient, adjuvants. These help to stimulate your immune system, and this usually is aluminum. But it contains a small amount of an aluminum salt, although the COVID-19 vaccines don't have any aluminum in them, right? And they also have stabilizers and preservatives so that the vaccine can work. It can keep its active abilities during transportation so that when it gets into your body, it can still work. And this is an example. I'm not going to show you all of them because it's some information is available online if you're interested. So this is just the AstraZeneca. So it's weakened adenovirus, histidine, sodium disodium editate, ethanol. These are preservatives. Magnesium chloride, polysorbate, which is like a soap. It's an emulsifier, and then there's water. So there's no secret about what's in the vaccines. You can look it online, and you can see it's nothing strange, unusual that's in the vaccines. In terms of vaccine development, these are the phases of vaccination of the vaccine testing. There's the pre-test process, which is the first part, and there is the testing of the vaccine itself. The first phase, as you can see, phase 1, 2, and 3. Phase 1 looks to see if it's safe, and that's usually in tens of persons. So it's used to check to make sure that the vaccine is safe to be used. Then phase 2 checks for the effectiveness of the vaccine. And so in that case, what they do is when after they inject the vaccine, they check after a particular period of time to see if there is an antibody reaction, see if the immune system is reacting to the vaccine, producing that response that it's supposed to get. And then phase 3 looks at usually thousands of persons, usually about 40,000 persons, and this has been done. And that shows that puts persons in real world situations now. So it gives it to random, persons. You have two sets of persons, and they give it to they give one set of persons, I would call a placebo, which is not a vaccine, and give another set the vaccine. And then after a while, you call them in and you see, you compare the rate of infection of both persons to see if the vaccine made a difference. And of course, you know the results of that. It's widely available. The vaccines were shown to reduce the chance of infection in those persons, and then it goes through the review process. And that has been done. There are persons who are saying that the vaccines have not been approved. That is untrue. The vaccines have been approved. They got emergency usage, approval. And in terms of the Pfizer vaccine, it got full approval. So the vaccines have been tested and approved by appropriately trained and knowledgeable persons who are looking out for your interests. All right? And we have a long history of vaccination use. These are some of them. Diphtheria, measles, and so on. This vaccination is not a strange thing to us in Jamaica at all. We have a very high rate of vaccination here in Jamaica, so it's something that we should be proud of and comfortable with. And now many persons ask, this is one of the number one questions, why always that the vaccines were able to be developed so quickly? Now, there are a number of reasons for that. Number one, the platform that was used for the vaccines are not new, right? So they did not start from scratch. Other vaccines, they may have needed to start from scratch, and that would have caused some time delay. So they did not have to start from scratch with the technology. It was in use before. Even the whole issue of mRNA, it's not a new technology at all. It has been around for some time, but it's being used, so it's being used here. The next thing that they were able to do to save time was to run phase 1, 2, and 3 simultaneously. And that saved some time as well, right? So in times past, they would have run these these phases at different times, so one after the other. So they run sequentially. But in this case, they run simultaneously. What they did actually, they started phase 1 first. That's a safety part of it, right? To check to see the vaccine is safe. They did that part first before they started the other two. So they started it first. They started phase 1. And before phase 1 finished, they started phase 2 and 3, right? Now, what this does, it cuts down the amount of time needed to test the vaccine, but it does not compromise safety, because they said that they run the safety part. They started at first, and then they started others. Now, this would not pose a problem to us. It would more pose a problem to the manufacturer, because if at the end of, for example, phase 1, if they find that the vaccine was unsafe and they were already started the other phase, which have cost them money, and they find out that it is unsafe from phase 1, even though they're probably gone well into phase 1 and 3, they would have to shut down the testing of the vaccine. So they're the ones that would lose, not us. We'd benefit from getting an early vaccine, but they would not really lose. The other very important one, which I want us to understand, is this. When they did an assessment of past experience with the vaccines, not these vaccines, previous vaccines, what they realized was that the safety information, the safety data could be obtained within the first few months. You did not need 3 years to assess the safety of a vaccine, right? So they were able to identify that very, very important, experience that they had with past vaccines. So they realized that they did not have to wait for 3 years. You just had to wait for a few months, because you did not have situations where a serious complication would develop 3 years later. Complications develop in the first 3 months, and that is something that we have seen persons have experienced side effects of the vaccine, which you know of, which we'll speak about in a little bit. So in terms of safety is not compromised by shortening the period of time. There have been many incidents that we have done this in medicine, where we have changed the protocols for a treatment based on past experience, and they realize that certain things were not necessary. So this is not anything new at all, right? So persons sometimes ask, how can the vaccine be safe if they have done it such a short time? It's because because of past and putting into effect past experience with other vaccines, where they're able to say that it's safe. However, the scheduling of the vaccine, that is something that it will take some time to have, right? And that is being done now. They're assessing the situation to see what is the best schedule for the vaccine, if the current one is the best, or if they need to modify it later. But that's not as important as the safety. It has been tested for safety and effectiveness, and it has passed those tests, right? This is an example of some of the current vaccines. And as you can see, the cost of the AstraZeneca is one of the lowest, which is one of the reasons why it is being used. It's easier to store, as you can see, just regular fridge, whereas the others require very low temperatures, and of course, may be a bit of a challenge in our environments, right? As you can see, the effectiveness, and this is the initial information. Of course, with Delta, this information about effectiveness will have gone down, and we'll get into that as well, right? So this is how the vaccines match up, the Pfizer and the AstraZeneca match up against the Delta variant, right? As you can see, previously, one dose of the Pfizer would have given 45% protection, 2 doses 93.7%. But with Delta, it has gone down now to 88%. And with the AstraZeneca, 1 dose previously 48%, and 2 doses 74%, but has gone down now to 30 and 67% respectively. So there has been some reduction in the effectiveness against the variants. That's important to note. Well, you can see this chart may be a little difficult to understand, but I'll just explain what this means. The blue line here, it represents this is an experience from Israel in the earlier days with the vaccine. The vaccinated group was on the blue line, and the pink line is the unvaccinated group. And you can see a difference here showing that there's a reduction in the rate of infection in persons who have gotten the vaccines. And this is something I want us to understand. This is something which is being said out there. I want us to hear very, very clearly that the vaccine does not just protect against hospitalization and complications and death. It also protects against infection, right? You may have heard very prominent persons say that it may not protect you against infection. Recent research has shown, however, that the vaccine protects against actual infection. So a person who is vaccinated is less likely to be infected with the virus than a person who is uninfected. And I want us to remember that very, very important. It also protects against complications. There are some persons who will still get it, because as you can see, not a complete protection. So for those persons who have what they call breakthrough infection, there is a reduction in complications. As the Dr. Baker said earlier, those persons who are infected and are even end up in the hospital usually do better than those who are not vaccinated. So the vaccine protects against infection and hospitalization and death. And again, there are many persons who say they are waiting. The last figures, which is from yesterday, show that 5.64 billion doses of vaccines have been given so far, right? So for those who say they are watching and waiting, well, 5.6 billion is a lot of doses, right? In the US is 377 million, and you can see the numbers there. In Jamaica, yesterday was about 606,000 doses, with just 5.5%, and we are one of the lowest rates in the Caribbean right now. One of the lowest rates in the Caribbean right now. So we need to step up our game here, right? This is the dosage, for the 21 to 42 days, and so on. I don't spend too much time there. These are some of the side effects: injection site pain, fatigue, muscle pains, and so on. So usually nothing really serious. And some persons may have more serious reactions like difficulty breathing and so on. We are, trying to be open and clear. These are some of the side effects. So what about this whole issue of clots, right? What about this whole issue of clots? So far, what they have found is in terms of the AstraZeneca vaccination, the chance of you getting a clot from the AstraZeneca is about 14.9 per 1 million persons, right? And it's at an 18% fatality rate. Most persons who have gotten it have been treated. So, and you also have heard about the mRNA vaccines causing myocarditis. The figure I saw yesterday, this is not the most recent figure. This was, I think, a little earlier this year. 1,226 cases of 270 million doses of mRNA vaccines. So as you can see, it's a relatively small number of persons. Another one, Guillain-Barré, 167 cases out of 14 million doses. And deaths, yes, there are persons who have died, and I will not hide it. There are persons who have died from getting, after, I shouldn't say from, because of course, in terms of making a connection, this will have to be investigated. But as you can see, about 7,000 persons have died after getting vaccination out of 360. This is figures from the US, by the way, right? Now, so yes, there are persons have died, but we must compare this with the death rate of COVID-19, which is 1 to 3%, right? So we have to do that comparison to see that, you see, what I tell my patients is this, let us say this COVID-19 is a dangerous road, and there are two roads that we can take. We can take the vaccine road, or we can take the unvaccinated road, right? In which case, you're basically choosing the virus. When you choose unvaccinated route, you're choosing the virus. So it's either vaccine or virus. The virus, you could say, this is a road with 10 gunmen, and the vaccine road might have one, right? We're not saying to you that the vaccine cannot hurt you. We're not saying that to you. But we're saying just like driving can hurt you, just like wearing a seatbelt can hurt you, just like eating can hurt you, and drinking can hurt you, exercise can hurt you, every medical intervention can hurt you, right? If you look at aspirin here, 15.7, 15.3 persons out of 100,000 persons die from aspirin use, which is sold over the counter. which is a much, much lower rate, right? And one third of these are due to low dose aspirin. So we can see when we compare that the vaccine route is a much, much safer route than the virus route, which is what, as I said, Doc was explained to you earlier. So it's not that persons will not be hurt. Yes, some will, unfortunately, but it's a matter of what is the best decision to take in a difficult situation. Now, in terms of lives saved, it has been estimated that 139,000 persons have been saved in the US. And in Jamaica, that's during the first 5 months of vaccination. In Jamaica here, it has been estimated that 125 persons' lives have been saved in Jamaica. So the vaccine is saving lives right here in our lovely island of Jamaica. All right. Now, this is another comparison looking at, the infection versus the vaccine. If you look at kidney injury, there's a reduction in kidney injury in persons who have been vaccinated. If you also look at the abnormal heart rhythms, you can see a high of 160. This is persons in red are the persons who have gotten the virus. Whereas persons who have been vaccinated, there's a lower risk. Deep vein thrombosis, and this is very, very important, persons who have been vaccinated have a lower risk of a reduction in the risk of clots forming. And this is something that a lot of persons do not understand. There is not an increase in risk when you get the vaccines. There's a reduction. It's just that there's a particular rare type that is more common. But overall, there is a reduction in the risk of clots forming in persons who have been vaccinated. Very, very important for us to remember that. Also, heart damage, as you can see, persons who have been infected by the virus, there is a significant higher risk of getting heart damage from the infection than from the virus. So there is a significant reduction in risk to our health in persons who are vaccinated. Right? Persons who are at risk for risky populations, persons with life-threatening allergies, we don't administer vaccines to those persons, or persons who have had a reaction to any of the vaccines are not recommended to continue their course. Pregnant women, if they're in a high-risk situation, high-risk job, then they're recommended to have vaccination. If they're not, they may not be. But the most popular vaccines, the Pfizer, the AstraZeneca, they are expected to be safe. AstraZeneca especially has been permitted in pregnant persons. It is the live vaccines that are not recommended, such as MMR, and there are some COVID vaccines that are live vaccines. Right, so those would not be suitable for pregnant women. All right. I just want to speak briefly about the anti-vaccination movement, right? Now, you have to get a little history on this, so I want to keep it short. But the anti-vaccination movement have been known for a very long time, and they are against vaccination. And they don't. It's not that they have any scientific reason; it's a personal choice. But what has been happening of late is that these persons have been sitting down, and they have been making up negative stories about the virus. And let me just give you some of them, like the vaccine changed their DNA. That is false. That the vaccine causes infertility. That is false. How would they know that the vaccine causes infertility? The vaccine has not even been around long enough to assess that. So that is made up information. They say the vaccines have not been approved. That is also untrue. Vaccines are experimental. That's also false information. They will lead to you getting the mark of the beast. That is also false. And they will weaken your immune system. That is also false information. And that is how these persons operate. They don't like vaccination, and they are quite prepared to make up a story about it so as to discourage you. And I want for us to understand that it is not my belief that if you want to spread a message, it is okay for you to tell a lie to spread that message. That cannot come from God, right? God encourages us to speak the truth. And there are many persons out there saying that Bill Gates did this and Bill Gates did that. I'm sure none of us heard Bill Gates saying those things. Some persons, for example, said Bill Gates wants to depopulate the earth. What Bill Gates said was that he wants to help families to maintain, to keep their numbers smaller so that they are be able to support their families and get jobs. So he encourages persons to, he has facilitated the usage of contraceptive so as to help those families to be able to support themselves and so on. Persons have been twisting his words. So yes, you would have said that the world's population is too much, which is true. We are outstripping our resources. But then they went on to add to that now that he says it's going to depopulate the earth. Nothing like that has been said. A lot of us pass around these messages. They are false messages, and we should not align ourselves to persons who use deception to spread their message. That's not of God, right? No, they say vaccines can cause injury and death. That is true. Drinking water can cause injury and death too. Exercise can cause injury and death. Driving can cause injury and death. Everything in life can cause injury and death. So to say that something can cause injury and death is not really information that is new. The first autopsy that I witnessed was a young lady who died from antibiotic use. So medications can cause injury and death. Surgery can cause injury and death. Yes, it's a matter of comparing risk and benefit, right? It's important to know. Another important thing I want us to remember is that there are a lot of counterfeit messages out there, a lot of false information. If you go to a bank, right? If somebody give you some money and you take it to the bank to lodge and the bank teller tells you that this money is counterfeit, you're not going to question what the person is saying, right? Because that person has been trained to know what a counterfeit dollar looks like, right? Now, it's the same thing with us as doctors, right? We know what a counterfeit message is, right? We can advise you based on our training what message is a counterfeit. I've heard persons say some very interesting things that they don't trust us as doctors, and that is very, very interesting, right? But that is their choice. As I said, we are in healthcare. We have been trained. The same, the knowledge that I use is information that I got during medical school. I started medical school back in 1993, right? So it's long before COVID, right? It's the same information that I use to treat my patients now and advise them, right? It's nothing new, and it has served me well, served my clients well, and I'm sure it will continue to do so. So let us be careful about these messages. These persons who are spreading these messages, they're not coming from a good place, and their intention is not pure. Some of them do this thing as a business. They're not looking out for your interest, right? It's my own experience, my vaccination. I just want us to understand also that Ellen White herself was vaccinated, and she encouraged others around her to do the same. So, so for those persons who say that if they're going to follow Ellen White got vaccinated and encouraged others. So if you want to follow her example, do what she did. So I hope that this information has been useful for you and that you will share it with those who you have opportunity to do so with. And now open the floor to questions.
Thank you, Dr. Street. Brother Amoy Hewlett will be assisting us with some of the questions from the chat. Brother Amoy, you're up. Go ahead quickly. Thank you.
Very well. Thank you for the presentation, Dr. Street. Sister Morgan, Eugene Morgan, she asks, what about the people that has underlying issues? What that cannot be vaccinated? What can they do to help boost their immune system?
It's a very excellent question. No, the only underlying issue where we don't recommend vaccination is persons with life-threatening allergies. When we say life-threatening, we mean persons who have actually have to be admitted to hospital because of an allergy. No, I just want to help us to understand something. The virus causes death by triggering an inflammatory response inside the body, inflammation. And that inflammation causes clotting and causes damage to your lungs, to your heart, and to your kidney. Persons who have chronic illnesses like hypertensive, diabetics, arthritis, heart disease, strokes, they already have a high level of inflammation inside their body. When you add the virus to that, then they are more likely to be hurt by the inflammation than a person who doesn't have those illnesses. So in other words, persons who have underlying issues are more in need of vaccination than a person who doesn't have it. So, so those persons should be at the head of the line, which is what they did. they encourage the persons over 60 to be at the head of the line to get vaccinated first because they needed it more. So those are the only persons who are not recommended are the persons with life-threatening allergies. Other persons, they should get it first.
All right, thank you. I hope we're taking note and we're listening, members.
Let me just add one more thing. Now, there are many persons who speak about the health message. What about the health message? The health message is very, very important, and we spoke with that in the earlier part of the slide. We're not saying health message or vaccination. We are saying health message plus vaccination. I also want to say this: a vaccination is not a drug, right? It's not a drug, right? It is a method of enhancing the immune system, and it is natural. It is not artificial, right? It's a natural way of enhancing your immune system. It's not a drug, so it is quite safe to use. We are quite comfortable taking vitamins which are man-made, right? And vitamins can hurt you too. There are some vitamins that can poison you, right? So we should not say that a vaccine is man-made. It's something that, as I said, it's just a way that we're enhancing the immune system, and it is a natural way. We have been given the intelligence to stimulate the immune system using these things that are made naturally, because your body actually makes it in some cases so that you can be protected. So we shouldn't fear it, just as we don't fear taking vitamins.
All right, let me jump in on a question here from our family panel. Someone is asking, how long after having the COVID, how long after can someone take the vaccine who's had COVID? And someone is also asking for a little bit more information about if you're pregnant, how to proceed. Those are two questions from our family panel on the inside.
Excellent questions. The pregnancy issue is kind of tricky because part of the reason is because of the increased transmissibility of this particular strain. Now, pregnancy increases inflammation inside the body as well, right? Pregnancy increases inflammation inside the body as well. So pregnant persons are at an increased risk of complications of COVID-19, right? And I've heard of pregnant women have died leaving their babies, right? So that's not a reason not to get vaccinated. But what we say is that if you're definitely if you're working as a receptionist, working in a doctor's office, working, we have to interact with persons face to face, and you're pregnant, definitely we'd want to encourage those persons to be vaccinated as well. The vaccination is the AstraZeneca vaccine and the Pfizer vaccine. They are not live vaccines. They are safe to be used during pregnancy. So we should not have any fear about getting vaccination during pregnancy.
And if you have had the COVID, how soon after can you proceed to have your vaccination? And answer while you're at it, can you have COVID a second time? And answer while you're at it, if you have had COVID, do you really need to be vaccinated? Because person says, oh, have natural antibodies. Roll the 3-in-1 quickly, thanks.
Excellent question. I'll answer the question with a story. I had a patient, young patient, about 25 years old, earlier this year. She tested positive. She didn't have much symptoms. And she was under the understanding that she should wait 6 months before she got vaccinated. And she called me this week, Tuesday, telling me that she was infected again, right? This time having more symptoms than the last time. So natural immunity is not a guarantee. The recommendation is that if you have not been infected, if you're unvaccinated, pre-infected, in other words, before you get infection, the best option for you is to get vaccinated. If you have been infected with COVID-19, the best option for you is still to get vaccinated, right? But the recommendation is that you wait 3 months. The reason for that is the vaccine, the protection that the vaccine gives you reduces over time. And what has happened is that the Delta variant actually causes 1,000 times more viruses to be produced in your body than the previous strain, 1,000 times, right? And that is why there are some persons who, so many persons are being infected now, right? It's much more transmissible, right? So you should wait 3 months after you've been infected to ensure that Now, just want to explain about Israel experience while I'm on this. There's some person to look at Israel and say, how is it that so many persons in Israel got infected? The reason is Israel started their vaccination program from very early, as you remember. What has happened is that because of the Delta variant being more transmissible, effectiveness of the vaccine has gone down. So the persons who got vaccinated earlier, they are the ones who are being infected. The ones who have been more recently vaccinated, like say about April, the vaccination protection still is maintained at a high level. But for example, those persons who got in earlier, like January and also December, they are the ones who are becoming infected. Now, that is why they're having discussion about getting a booster, right? Getting the booster will bring back up your levels even higher than they were before, even when they got those 2 shots. So that is why the booster discussion has actually started. And that is something I want us to get clear. Israel is an example of why boosters are important.
Excellent, thank you. We'll take another question from Brother Amoy, and Pastor Douglas has also been monitoring the chat.